The prostate is a gland that surrounds the male urethra and helps produce semen, the fluid that carries sperm. Prostate cancer is the cancer of the men's prostate gland, usually in the middle age or later. In this disorder, certain cells in the prostate become abnormal and multiply without control or order. The excessive amount of cell division forms a tumor, which is an abnormal mass of tissue. Some of these cancerous tumors can invade surrounding tissue and spread to other parts of the body due to metastatic cancers. The signs and symptoms of metastatic cancer depend on where the disease has spread. If prostate cancer spreads, cancer cells most often appear in the lymph nodes, bones, lungs, liver, or brain. Bone metastases of the prostate cancer most often cause pain in the lower back, pelvis, or hips. As the tumor grows in size, some symptoms and signs include, but are not limited to, difficulty starting or stopping the flow of urine, a feeling of not being able to empty the bladder completely, blood in the urine or semen, or pain with ejaculation. Some risk factors of this disease include age, race or ethnicity, genetics, family history, environmental factors, and Agent Orange exposure. More than 60% of prostate cancers are diagnosed after age 65, and the disorder is rare before age 40. In the United States, African Americans have a higher risk of developing prostate cancer than other races and can develop this cancer at a younger age and also have more aggressive tumors that grow quickly. On the contrary, Hispanic men have a lower risk of developing prostate cancer and dying from the disease than non-Hispanic white men. Prostate cancer occurs most often in North America and Northern Europe. An increase in prostate cancer in urban environments has been studied. Locations such as Hong Kong, Singapore, and North American European cities seem to be noticing this increase. Risks for prostate cancer also increases in men who do not have much physical activity or exercise. Family history also plays a major role in the chances of developing prostate cancer. Prostate cancer that runs in a family, called familial prostate cancer, occurs about 20% of the time. This type of prostate cancer develops because of a combination of shared genes and shared environmental or lifestyle factors. Hereditary prostate cancer is where cancer is inherited, is rare, and accounts for about 5% of cases. Hereditary prostate cancer occurs when gene mutations are passed down. The following situations raises suspicion for having a gene inheritance: having 3 or more first-degree relatives with prostate cancer, having prostate cancer in 3 generations on the same side of the family, having 2 or more close relatives, such as a father, brother, son, grandfather, uncle, or nephew, on the same side of the family diagnosed with prostate cancer before age 55. Inheritance of certain genes is also a risk factor of prostate cancer. Hereditary breast and ovarian cancer, HBOC syndrome, is in fact a risk. HBOC is linked to mutations in the BRCA1 and or BRCA2 genes, aka the breast cancer 1 or 2 genes. It is known for its presence to cause an increased risk of breast and ovarian cancers in women. However, men with HBOC also have a higher chance of developing breast cancer and a more aggressive form of prostate cancer. It is recommended for men with BRCA1 or BRCA2 mutations to start getting screened at an early age. Other genes that may carry an increased risk of developing prostate cancer include HPC1, HPC2, HPCX, and CAPB. There is no sure way to prevent prostate cancer. Many risk factors such as age, race, and familial history can't be controlled, but there are some things you can do that might lower your risk for this disease. Studies have found that men who are regularly physically active have a slightly lower risk of prostate cancer. Vigorous activity may have a greater effect, especially on the risk of advanced prostate cancer. Several studies have suggested that diets high in certain vegetables, including tomatoes, cruciferous vegetables, soy, beans, and other legumes, or fish, may be linked with a lower risk of prostate cancer, especially more advanced cancers. Examples of cruciferous vegetables include cabbage, broccoli, and cauliflower. Although not all studies agree, several have found a risk of prostate cancer in men whose diets are higher risks of prostate cancer in men whose diets are high in calcium. There may also be an increased risk from consuming dairy foods. Some drugs may help to reduce the risk of prostate cancer. 5-alpha reductase inhibitors blocks 5-alpha reductase enzyme from making DHT, which causes the prostate to grow. Men taking this drug were less likely to develop prostate cancer after several years than men getting an inactive placebo. Research also suggests that men who take aspirin daily for a long time may have a lower risk of getting and dying from prostate cancer.
It's important to begin preventative care throughout one's life,
Since prostate cancer is a slow-growing cancer, thus it's better to always remain in good health and good physical shape, practicing good habits like smoking cessation, exercise, and weight control. However, it is extremely important and vital that one starts taking extreme care of one's body and undertakes preventative measures as they approach 40 and go into 50 years of age. Also, prevention is most important if one is African American or a Caribbean man of African ancestry, also starting from a young age. Also, if one has a family history of prostate cancer, they should take preventative measures throughout their lives, but especially as they start approaching later ages and stages of life. Starting from about the age of 45 or 50, if a man isn't at as high of a risk for this type of cancer, men should begin getting screened for prostate cancer. The frequency varies by patient and depends on how much of a risk the patient is at for developing this cancer. If the risk is higher, which occurs if one has a family member who has developed prostate cancer prior to 65, or if one is African American, the patient should opt to have the PSA blood test, where blood is drawn and tested for the presence of prostate-specific antigen. Along with this PSA blood test, men should have a prostate exam. Again, the frequency of the exam depends on the risk, which is where an ultrasound probe is put into the rectum of the anus and used to check for any abnormalities and lumps. However, these two tests may not be that accurate or conclusive as to whether a patient has prostate cancer due to the fact that there are many factors that can affect the size of the prostate and the level of the PSA in the blood. The only surefire way to know whether a patient has prostate cancer is through a biopsy. A DRE and PSA test serve the purpose of having a quick test to see if there's any condition that is indicative of prostate cancer, such as lumps and a high PSA level in the blood, which could alert the physician that there's a possibility that the patient has prostate cancer. This would then lead the physician to call for an ultrasound and MRI-guided biopsy, which would then officially check to see if the patient has prostate cancer. In this type of biopsy, the doctor collects tissue samples from the prostate gland for examination by a pathologist to determine whether or not the tissue is cancerous. During the ultrasound-guided biopsy procedure, a special biopsy needle is inserted into the prostate gland through the wall of the rectum to remove several small samples of tissue for pathologic analysis. In an MRI-guided biopsy, prior to the actual procedure, prostate MR images are examined and used to pinpoint specific areas that may require evaluation. Then, the MRI-guided biopsy is performed, where MR imaging is used to guide the course of the needle to the desired position within the prostate. How often a man should be screened depends on the risk. It should begin at age 50 for men who are at an average risk for prostate cancer and are expected to live at least 10 years or more. It should be at age 45 for men at a high risk of developing prostate cancer. This includes African Americans and men who have a first-degree relative diagnosed with prostate cancer at an early age. It should be age 40 for men at an even higher risk, which is often characterized by having more than one first-degree relative who had prostate cancer at an early age. Once one knows that they are at risk or have prostate cancer, there are many different treatment options available. The number one treatment option that is available for prostate cancer is chemotherapy. Chemotherapy utilizes drugs to kill cancer cells, hence stopping their ability to grow and divide. Systemic chemotherapy uses the bloodstream to attack cancer cells that are found throughout the body. Chemotherapy for prostate cancer is delivered with an intravenous tube, IV tube, placed into a vein via a needle. This may benefit patients that have advanced or castration-resistant prostate cancer. There are also several standard drugs used for prostate cancer. Some standard chemotherapy begins with docetaxel in combination with a steroid termed prednisone, and there are also other multiple brand names. This type of chemotherapy has been shown to help men with metastatic castration-resistant prostate cancer live longer when compared with any other chemotherapy drug. Hormone therapy is also another cancer treatment that removes hormones or blocks their action and stops cancer cells from growing. Hormones are substances made by glands in the body and are circulated in the bloodstream. In prostate cancer, male sex hormones can cause prostate cancer to grow. Drugs, surgery, or other hormones are used to reduce the amount of male hormones or block them from working. But ultimately, approximately 1 in 9 men will be diagnosed with prostate cancer at some time during their life. In addition, studies indicate that many older men have undiagnosed prostate cancer that is non-aggressive and unlikely to cause symptoms or affect their lifespan. While most men who are diagnosed with prostate cancer do not die from it, this common cancer is still the second leading cause of cancer death among men in the United States. The estimated statistics related to the prostate cancer in 2018 estimated approximately 164,000 new cases of prostate cancer and about 29,430 deaths from prostate cancer this year alone. But the outlook for those with this cancerous disease is only going to get better by your help. You can do your part by spreading the word and sharing information about prostate cancer while not being afraid to talk about this topic. You can also wear the signature light blue ribbon to show your support for the fight against prostate cancer. And you can visit www.cancer.org to learn about prostate cancer, as well as www.myprostatecancerroadmap.com.